Bill, how about speaking of the data, speaking of the records, you all again been on a great journey there, a lot of success. Give us a specific program that you'd like to highlight, an element of maybe the overall macro program that you're working on that you'd like to bring to the attention of everyone.
Oh, there's great stories being told, and I'll tell you, it's inspiring to me. I'm a defense acquisition guy by history and trade, but as my beard turns gray, so I love programs and I like to talk about the specific programs and program successes, because that's what you do in defense acquisition. You deliver a program, you manage cost, schedule, and performance, and you get stuff there. But as I turn gray, and as Nick brought automobiles into this, I'm going to give an example of what really excites me about what's happening in health IT and our support. I was at Costco the other day, and I was waiting in line to get fuel for my vehicle, like everyone else was, because there was a breakdown in a fuel supply chain system, right? And I watched a Bentley pull up, and it was actually a Bentley. There's a young lady in a Bentley, and I was thinking, wow, she's got to wait in line with everyone else because the problem is in the fuel supply chain, right? So generally, what our interface to the fuel supply chain as individuals is we go to the gas station with that's the most convenient, the lowest price, has the best fuel, whatever, and we go there. And we don't think about anything about the entire supply chain that gets that fuel to us. And that's right. And that's what I'm feeling and seeing and hearing in this group. Right, with the work that ONC is doing, with the work that the CIOs are doing, and the work that our industry partners are doing, we're getting all the capabilities here to make it about getting the data where it needs to be so that providers can deliver the right healthcare to patients and beneficiaries when they need to have it. So not talking about specific programs, not talking about specific use cases, just knowing that collectively, because we're all the IT people, right? We all do enterprise IT in some form or fashion, and we love to talk about it. But when the people we're supporting just know that they're going to have what they need, and they're not worried about the name of our program, they're not worried about MHS Genesis, they're not worried about what the Jake is doing, and then they just know that they're going to get that virtual microscope or whatever it was, that awesome use case you said. When all of this ties together, when we're not spending months and years building the interfaces, we just know that all of these pieces are going to result in an operating fuel station, an operating healthcare delivery system that people can enter, make choices about where they want to enter, and get the services they need and come out feeling better and get the record out of that. That's what excites me. And I know, Luke, you asked for a very specific use case. I just was so excited listening to everyone else's, because it all builds to this, frankly, magical use case. And I'll give this example. On the DoD side, building out and doing their deployments, there was a need for max vaccination capability, right? And as we deployed, I think it was 3 waves ago, they put this mass vaccination capability. It dropped vaccination times down to the floor. I think it cut them by 80% or something like that. It was initially used at Camp Pendleton with new recruits coming in, or actually it was, I think, units getting ready to deploy, not new recruits. But it also went to MCRD. And immediately that was turned around by the company that developed it with DoD to make sure to meet that DoD need. It's now part of a commercial product, and it's supporting the delivery of COVID vaccinations nationally, well, internationally, frankly. And that's the kind of standards-driven, infrastructure-driven transformation I'm seeing in health IT. We're now just talking about the capabilities, and we have providers and administrators of health systems that just expect us, the people on this call, to give them the capabilities they need. They don't want to hear about programs. They don't want to hear about IT. They want to hear about what they can do, and they want to know that they can make the best decisions they can make without going to talk to the IT people and asking if they can deliver healthcare the way they need to.